I was saying, I was made to sing gospel reggae, and of course, I give thanks to my God and I, of course, man, Lieutenant Stitchy. You know, I've not heard a lot about Lieutenant Stitchy. I don't know how is Lieutenant Stitchy doing. You know, this is a story that probably just fell through the cracks in a little while because it was a big thing and it was all over the world, and we're talking about it. But I don't remember seeing or hearing much about Lieutenant Stitch's condition. The last time we checked, he was in the hospital and he was unresponsive and required medical care, medical assistance. There was also a need to raise funds to help to defer some of those costs to the popular gospel artist who was in dancehall and then turned gospel, you know. But then what happened was that the dancehall friends came out in solidarity, the ones who he shared those pulpits with came out and helped him or started, you know, putting some money down to assist him. I am thinking that the persons, the church would help as well and put some money in, you know, in collaboration with the theme, we are our brother's keeper, you know? So I'm thinking that's what we do as people of God. Ensure that we follow suit and do a righteous thing. Yeah. So Lieutenant Stitchy, I've not heard much about him, so I might just went there. I thought I'd play a Lieutenant Stitchy this morning in solidarity to the big man himself, and of course to the many contribution to Christianity and of course gospel music. You know, we are having conflicts over the idea of what gospel music is, how it should be, who should sing it, and what rhythm it should be on. We're still looking at that one. Well, it could be the bar room. Um, it could be the bar room country music rhythm, that country music that was popular, played in the bar rooms back in the day, and probably still is, you know, or R&B, which is, you know, a good genre because it's a nice clean sound. You know, I like it too. You know, both of them I do like. So, or some reggae that is not so much welcomed around the circle so easily. But I do believe that there's a time and a place for our songs and which one we play where and when. So yeah, my morning service might benefit a little different. My morning service might benefit a little different than my afternoon service would do.
Created about
This one's from Lieutenant Stitch. He says, fast and pray. And when you're fasting and praying, who do you fast and pray for? Those who are already secured in the church already? I played this song many times at certain locations where people are at and Christian people with Christian values are. And I'm telling you, the pushback that I get when I play this one was like terrible. Lots of persons don't like to hear this one, but I want to play this one right here.
Really?
5 minutes to understand that. Listen, probably you should take a chance to listen to what the man is saying and then realize that the powerful ministry that you have is not to re-evangelize those who are in God's temple already, but the ones who are not yet understanding that they should be. Go back, go fetch your friends, them who you and them are commit crime with. Go look for them, bring them, come. Go for your friends. When they used to, you know, rob and steal and do all sort of bad things together and all of that. if you have God has touched your life and you become a Christian today, go get your friends them out of that nonsense life. Because that's what Christianity is all about. Oh no, guess what? You need to get your shovel and go deep dive for the person's sin so you can expose them again.
Michael G, it is a beautiful, beautiful morning this morning, and of course,
Here he comes, Lady Elisa, don't know.
it is indeed a beautiful morning here.
You can see our joining the stream. All of Wellness Wednesday. Today, of course, we just listen to the man Milton and Stitchy. It no shot the monster this morning. Of course, we begin another one. Questions, questions, questions. All the questions that you may have this morning. Of course, it's Wellness Wednesday this morning, and another beautiful Wednesday morning right here in the Grand Cayman Islands. Of course, this morning you can ask your question directly to your doctor this morning. Of course, have those questions answered. And indeed, we are, excited about that one. There are many persons who have some questions, so we are waiting for some of those questions to be answered at this time.
Yeah, I mean, how often do we get a chance to get a virtual sort of a consultation and find out what's really happening? It's not often that we do get that opportunity, and of course, we are happy for that one. So, of course, we want to take this opportunity to say good morning to Dr. K this morning. Um, you know, are you ready to hear all of my problem? You have to promise not to tell nobody. don't don't tell it. You have patient, doctor patient confidentiality right here,
Correct,
Dr. K.
correct, correct, correct.
All right, so I want to say good morning again to our listeners. Of course, Dr. K will be answering a few questions this morning for us. I know um, Christmas is coming and the goose is getting fat, and you plan to have one whole heap of food. But of course, Dr. K, she cautioned us last week, and I know she has stuff to share with us this morning as well. I want to thank you for opening your virtual office to us this morning and I really recognize that her knowledge is a source of ministry. And she doesn't hold back. She wants us to be well. Morning, Dr. K. Welcome to Wellness Wednesday.
Good morning, Lady Elise. Good morning, Mikey G.
I want to say at my quote of welcome to this morning, Dr. K. Of course, as she said, the doctor privilege confidentiality this morning. When I say what I'm saying, I'm going to turn off my microphone so nobody else hear the question. So we're going to have that one just between me and the doc this morning. But so guys, if you have your own questions, please ask your own questions. Don't wait on mine. All right. Have your own problems, man. Have your own problem solved. Don't come expect I my problems to solve yours. I am solving mine this morning. So I want to say good morning to you, Dr. K. Of course, welcome to the breakfast hour, and of course, another Wellness Wednesday right here on Flashpoint. Of course, those who are listening to us on www.flashpointmedia.ky, of course, you can log on to our YouTube and our Facebook at Flashpoint Media. That's it. All right? Don't need to do anything else. But if you go to flashpointmedia.ky, then you just simply branch into all our social media platform. You don't have to go searching, typing in anything. Go one place. It's a one-stop shop. Of course, we are Wellness Wednesday today, and of course, for me, I'm bursting with questions already. Some of
Well,
them I can't even
I
start.
won't let you burst on air. I'm just going to start by asking the first question that I have here. What are the most important screenings or tests people should have at different stages of life?
Okay, so that's a good question. And screenings actually start early. So from your born, you're screened. So
Wow.
a baby that is just born, and depending on the situation with the pregnancy, they may be screened for different things.
Mm-hmm.
So we know that sometimes babies are born and they're screened for, especially in the Caribbean where we have a black population. The first thing that they do is they get their cord blood. That is
Uh-huh.
from the umbilical cord, and they're screened for genetic disorders like sickle cell disease. So just about, I'm not sure if it's the entire hospitals in Jamaica, but I know that at the University Hospital, that's one of the tests that's done on the cord blood. Okay, because the sickle cell unit is there, so they screen for sickle cell disease, and sometimes they screen for other genetic disease. In the United States, they screen, especially if you have a family history of, say, celiac disease or other diseases, you're screened. The cord blood is screened. The other thing that happens is that they're screened for jaundice. So your baby comes in, and sometimes, depending on what's happening, they could be screened for lots of different diseases. Trisomy 21, which is Downs. They could be screened for any other genetic disorders. Um, so yes, from day one, they're screened. From day one, from day one, from day one, a baby. In fact, sometimes before
From day
even
zero.
from day zero, because they're screened
Yeah.
in intrapartum.
Yes.
The mother is screened depending on, especially if she's a elderly primigravida, or she is you call pregnancy in old age, and
You
that
have to
is
break that one down, Dr. K. An
a
elderly
woman primigravida, a
elderly
woman
and
with.
pregnancy don't go in
Hold
one
on.
sentence.
Yeah,
Let's
but
Mikey
go.
G.
actually, but
Elderly people gravel law.
for example, a woman who, even if it's her first pregnancy after 35, or even subsequent pregnancy after 35, because after 35, they're thinking that your risk increase. So the risk increase for birth defects, for different things, especially Down syndrome and other things with the baby. So a woman will be screened at that age if she's pregnant after 35 for problems occurring with the baby.
Wow.
So, right. So in pregnancy, you're screened. So the baby, before the baby is even born, the child is screened. So we go through that. But even after your child is born, there may be screening. You do your hemoglobin, your white blood cell count, just to check, just to have a baseline.
Mm-hmm.
And then you may not get screened, probably later on in life when you become a teenager. Your doctor might just do just regular screen, check your cholesterol, check your lipid level, check your hemoglobin again, just to make sure your platelets and everything. This might not be done once a year, this could be done every 2 years, but these are screening tests. When you get older into your 20s, you do get these tests done again, just to make sure that everything is on track. Your HbA1c, looking for your glucose control, looking for making sure that your lipids, your cholesterol, and everything is okay. Your platelets is fine, your hemoglobin is fine, your white blood cell is fine, and there's nothing happened there. And that's just a basic screen. When you get older, so you get into your 30s, they continue the screen. But by the time you reach 40s, then you have a lot more screen going on.
So you're
So, so by the time you reach 40s, if you're a man, they might want to do a basic PSA level just to make sure that your prostate is okay. They
mm,
might want to do just regular bloods again with your, just checking your cholesterol and everything else. A woman at that time, depending on her family history, And then for a man, depending on his family history, he might get it earlier than 30, than 40, could even 35, because if he has a relative with prostate cancer, an immediate relative, whether it's going to be a sibling or it's going to be a dad, then he would want to get screened earlier. A woman, she's going to get her mammogram, okay? And a woman who is sexually active, from the moment she gets screened. So she starts getting her pap smears from early in life. So
So
the
so
screening starts.
so for the woman, as you mentioned, that the pap smear begins not at a particular age, then, but it would be when their sexual activity. So after sexual
Correct.
activity, then there is
Right.
regular screening with your pap smear. But if you have never been sexually active, is it something that a woman should consider doing? Say you're 40 and you have never been
Okay.
sexually active. Do you still
So
need
a
a pap
woman who
smear?
so a woman who is 40 who is never sexually active, we're looking for HPV. And HPV is only had during sexual activity.
Mm-hmm.
So a woman who has never been sexually active is unlikely to get cervical cancer because HPV is what causes it. So she has to get it from somebody.
Mm-hmm.
And since nothing has ever been there, then it's unlikely. But what she can do is probably get ultrasounds just to check her pelvic structure.
Mm-hmm.
So she probably wouldn't get a pap smear, but she would get an ultrasound to check her pelvic structure. Right? We try not to do pap smears in women who have never been sexually active.
Okay, okay. What about for the breast? You mentioned the mammogram, and of course, we. I mean, I think there are different ages. Some persons say 38, some say 40 with the
40
start of your mammogram. And once you
mammogram.
start having mammograms, how often do you need to have them?
Okay, so if you are having mammograms at that early stage and that's nothing happening,
Mm-hmm.
you can go every 2 years just to screen. Once you get older, you tend to go every year, but initially, you don't need to screen. You don't need to screen every year.
Well, here's where I'd go earlier is when you
But
have.
it all depends. Hold on. If you have a family history, then yes, you will go on with your screening yearly.
Well, I would go back. I would go back to when you started off at childbearing and the defects that can take place
Mm-hmm.
with late pregnancies. I'm trying to keep a straight face on this one, but the truth is, it's a real question. It is very important. Is it recommended though that women do have pregnancies at these late stages in their lives?
I mean, Mikey G, that's a
Yeah.
personal thing because I can't say it's recommended or not recommended. It's a personal thing because a woman, it's she's been trying to get pregnant for 10, 15, 20 years. And when she becomes 41 is when she gets pregnant. So, and then, that's her first pregnancy. She's 41 years old. The truth is that there is a peak time for child rearing, but it doesn't mean that when you're 40s, you cannot have an awesome baby.
And for the
And
benefits of the
right,
listeners, what are those peak times for child rearing or having birth, starting having children? Are actually those periods where you should be considered the best time to have children? And if a man wants to get married and he
early
decides to have
20s.
children, and he decides to have children and he wants to pick a very fertile time to have the best child that he can, bouncing baby girl or boy, what's the best time for that?
And we will always recommend your 20s, but then remember that different women mature at different times. So a 20-year-old woman might not be the same as another 20-year-old woman. A 20-year-old woman could be very childish, or could her body is not fully there, and there's a 20-year-old woman, man, she full. So it all depends on the person.
Yeah.
So the ages be 20s, in the 20s, like 20 years of
You
age to to what cutoff point?
I mean,
35.
usually the 20, yeah,
She said 35 is elderly,
is when you have the risk. So right
higher
there,
risk.
So you're looking at stopping having children. You're supposed to be stop trying to have
by the
children at 35, not trying to start get pregnant.
Yeah, but it's not always possible, Mikey G.
No, no, what I wanted to do with that was just to make clear that it is not a case where you are having problems to have children. You don't do everything else, and then at 35, you're now busy trying to get children. You should be trying to get children before 35, that when 35 comes, you don't want to be trying so hard. But if you're having a problem, like you're having a real situation, then oh my God, it is unlikely that God would just not bless you like a Sarah. You know, a Sarah exists every time somewhere, but you can't make yourself a Sarah by deliberate means, you know? And that's what I would want to say.
and the thing about it, Mikey G, is that women who are early, who are having children early, say for example, even early 20s, can have birth defects.
No, no, I'm not talking about the birth defects that they can have because what I would say, Doc, is that sin is a factor. Sin is a factor, and I've seen so many people who wants to use the most defective thing to say that because I am like this, it is I am perfect this way. Yes, you are perfect in God's sight, but God forbid, man, you know that this is not how God would intend you to be. I mean, I was born crippled and I didn't have any eyesight. No, I was not born with all the attributes that I was supposed to be born with. So I came out a little bit not having all the things together. But that don't mean that I'm not a real person and God don't love me and people don't love me. But do not go around telling people that I am the same as the rest of persons because I'm going to need some braille to work with because I can't see, or I'm going to need to listen more than I talk,
Hmm.
right? Because I can't see, and all of these things. But we want to make sure that we do not create the what you call the defects for ourselves mentally first without we having them by birth, you know.
Uh,
And this is where I wanted to land that.
and of course, I have another question, Dr. K. It's connected to what you have been discussing so far. And one of our VIP members would ask, can a doctor describe sexually active? Because I think we, in relation to when you're doing your pap smear and so
Yeah,
on.
Can
like
can
when the mothers carry the daughters to the doctor and say, check her and see if she having any form of interaction with anybody, doctor. Take her, let me know right now.
and that's really not a good thing to take your daughter to the doctor and say, can you check to see if she's sexually active? That's terrible. You shouldn't do that. Nobody should do that. Ask her, speak to the person.
Yeah.
Don't take her to the doctor to find out if she's sexually active. However, um, if you examine somebody, you can know that this person is sexually active or not, or this person has been sexually active.
Well,
But that's not a good thing to do.
mm,
Never take your child to the doctor to say, doctor, can you check this child if she's sexually active? The one thing the doctor is going to look for is the hymen, and if the hymen is not there, does it mean that the child is sexually active? No, because there are other things that can cause a child to lose her hymen. So you cannot say the absence of a hymen means sexual activity. It's likely, but you cannot confirm that it is.
So back, so to the question, what would you consider sexual activity then?
You mean you're talking about examining a person to say they have
No,
been
no.
sexually
This is. I think the question is, can the doctor describe sexually active? And I think it's based on the question that we had earlier about doing a pap smear, and if you have never had sex, never been sexually active.
sexually active, but the doctor doesn't look to see if you're sexually active. The doctor asks you if you're sexually active, and if you say yes, then they will do the pap smear. If they say no, then they're not going to do the pap smear.
Right. And you
So
know,
it doesn't matter. I remember having a child. I
mhm.
mean, many years ago, there was this young girl. I mean, she was probably, I don't know if she was 15, and she came to the hospital because she was bleeding a lot. And the private doctor sent her to the hospital because she was basically hemorrhaging. And she came to me and young girl, very slim, and she was bleeding, and I was there. There's no way she could be having her periods at that age for her to be bleeding so much that she was pale like a sheet. She
Mm.
was definitely hemorrhaging. And I said to her, "Are you sexually active?" And she said, "No, she's not." And but I didn't believe her, so I asked the nurse to give me the whole speculum set. And they were like, "No, no, 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 you can't do a vaginal examination on this patient because she's not sexually active." I said, "But I don't believe that she's not sexually active." Anyway, I went to her and I said, "You need to tell me the truth, because today you're going to die. And if you die, and you if you don't tell me the truth, you're gonna die, and there's nothing I can do. So you can't blame me if you die and don't tell me the truth." And she said, "Yes, I'm sexually active." But I knew, but at the time, I knew based on her symptoms. You know, the thing about it, people, it's hard to lie to your doctor. Your doctor will just look at you because what you're saying don't add up.
Like
And then
parents,
they'll just smile in their side because they're saying, "Why is this person lying to me?"
like parents, doc.
Like your parents, you're lying to your parents and then know you're lying to them and they're waiting for the truth. So you go to your doctor and you're telling them one, giving them a story, and your story don't add up. I remember another patient came to me. I mean, you know, it was in an open emergency room, and I said he came in and he said, I said, "What? How can I help?" He said he's diabetic. I said, "You're diabetic?" He said, "Yes." I was a young doctor then, and I said, "So what are you taking? Are you taking pills or insulin?" He says, "I don't know." So I said, "Where's the medication?" He left it in the car. So I said, something is wrong with this man. So I went to another senior doctor and I said, um, "Something is wrong with this man. He's not telling me the truth. I don't know why he's here because I can't help him." And she said, "Take him in a private room and talk to him." And when I did, he was HIV positive.
Wow.
So sometimes sometimes the patients will come to you and they tell you different things. And a patient comes in and the nurse is screening her, and she said she has chest pain. And the nurse said to her, "Are you sure you have chest pain?" And she said, "Yes, she has chest pain." And the nurse said, "If you tell the doctor you have chest pain, do you know your doctor is going to charge you so much money? They're going to do an EKG, they're going to do labs, they're going to do everything. So what is the real story? Are you really having chest pain or there's something else happening to her?" She said, "I want to talk to the doctor." I said, "Okay, that's fine." She came and she spoke to the doctor. She was having problems with her boyfriend and she left the house to come to the hospital. But to be seen quickly, chest pains will always be seen.
Yes.
So
But do not lie
quickly,
to your doctor, right?
yeah, quickly. If you are telling me you have chest pain, you'll be seen quickly. Unlike this man who's been
But
having
then, but
chest
then, but
pain,
then, doc, go ahead, sir. Go ahead.
unlike this man who's been having chest pain for 3 days, came
Yes.
to the hospital, barely coming to the hospital Monday morning, and he said, I said, "Sir, what has been happening to you?" He said, "My stomach hurting me." I said, "Your stomach," and he's been drinking milk because his girlfriend has been giving him milk all weekend, because his stomach is hurting him. I look at him, he was so sick, diaphoretic. I told the nurse, I said, "Sir, what is, which, show me your chest." And he showed me his stomach, and he said, "My stomach, my stomach." I said, "Oh God, this man is having a heart attack."
Yeah. Yeah.
40-year-old died on me within 15 minutes.
Wow.
Has been having a chest pain,
Drinking
and he
milk.
said he's, because if you say your stomach is hurting you, nobody's going to be looking at your chest. And
Right.
so, because this is his stomach, he ended up not getting the care that he needed. And by the time he reached the hospital, the horse had gone through the gate. He had 100% occlusion of his coronary arteries.
Mm-mm.
And coming in just a day earlier would have done, sent him to the cath lab, and this man would be able to live. So, she's coming in with a different story where she has no chest pain, and this man who had chest pain, and because he was complaining of a different part of his body, he didn't get the care he needed and lost his life. So, yes, sexual activity, we can determine sexual activity, because remember, a doctor is trained, and especially children who are probably having some trauma to the vagina, whether it's sexual abuse or stuff. We try, even those kids, we don't just go ahead and examine them. We try to do them under anesthesia. So you sedate the child a little bit to examine the child because it's a very traumatic experience.
Very traumatic. And of course,
So you don't, right, you don't go through and just examine a person just to look for sexual activity. It's not a very pleasant experience.
and of course, our viewer, our listener is just clarifying. She's saying, do you have to be having sex daily, monthly, or yearly to be considered sexually active?
Well, sexually active means that you're actually, it doesn't have to be daily, it could be monthly, it could be weekly, but at this period of time within this year, you've been having sexual activity. So if you're not, if you used to, for example, my I might have an 80-year-old and I said, are you sexually active? And she said no. She hasn't had sex since her husband died 20 years ago, or 10 years ago, or 5 years ago. She's not sexually active at this time. But I go to my 70-year-old, and there, oh my lord, she's having sex. I mean, it might not be every day, it might be once a week, it could be once a month, but she's still sexually active at this time. Because the point is that she could have had sex yesterday, and the last time she had it was three months ago. So yes, or a month ago. But at this period of time, are you having sexual activity? So it doesn't have to be every day, it doesn't have to be every week, but over a period of time, are you having sex?
And then that would
And that is
qualify
sex.
you
Yeah,
for
you say,
your pap
well,
smear.
you say I'm sexually active. I'm sexually active. It doesn't have to be every day, but I'm sexually active at this time.
Okay. All right.
So let me ask a quick question. So for like husbands and wives who lives apart, for like one person work away and they come, that they be go home in every 6 months, every 3 months, or 6 months. So
They sexually active.
so every 6 months the husband or wife might be home, and they make contact. How do you treat that? You consider them sexually active as well
Yes, they're sexually active. Yes.
in a 6 months apart?
Because yes, sexual activity doesn't mean that you don't have sex once in a while. It doesn't matter whether you're having it once in a while, every day, 3 times a day, 5 times a day, or even every week. As long as you're having sex in a particular time, within a year, you're having sex 1 or 2 times, you're still sexually active.
Okay. I just want to
Yes.
clarify, yes, and the factor of the aged person who would of course be having sex once in a while and probably, you know, be counted out a little bit. I am not sure if that would be the case.
You're not counted out. You're not counted out.
Okay.
I must sort of not balance, but uh, I I asked about the females who, as early as sexual activity begins, you're thinking about pap smear, and then at age 40, you're thinking about mammograms. But for the young men, after their parents would have been carrying them to the doctor maybe for their annual, maybe they have medical that they need to go to school, but after that they don't feel that there is any need ever to see a doctor again in their entire lives until they are
Why,
40.
why do you speak with such scorn of the young men who just look as if they don't want to see the
I'm
doctor? As,
sorry to portray
especially,
that.
especially if you're
Let me
especially
retract it. So
if,
doctor,
especially if you're going to go to see a male doctor, right? The doctor is male, right? And we don't want to see a man looking at us, really.
so,
I
so
mean,
doc, so
and it's a true thing, you know. So I would say, whenever my mother is want to get me to a doctor, take me to the pretty doctor. Take me to the pretty doctor, right? So when I realized that there was also women who were doctors, take me to the pretty doctor, all right? Because that's what I want to look. I don't want that man's touch on my skin. I don't want to feel a man touching me, you know. So I was very skeptical about doctors and stuff. So yeah, for me, I don't know if it is a thing anymore because since as everybody has become more liberal about the thing, but I would say that this was something that caused me as a young man who never wanted to go to the doctor a lot because I didn't want to see a man touching me, especially when we talked about prostate issues and all these things. I remember taking my father to the university hospital to do a prostate examination, and then all I could see is this man putting on his gloves and clicking it, plap, plap, and then going inside the room. I'm like, and then I didn't even understand what the examination was. But then God Almighty, man, come on. If couldn't it be a woman who actually come and actually did the examination? Couldn't you have women doctors? and
But
and quite a few
Mikey
male
G,
doctors who are volunteering for this procedure.
Mikey
And
G,
I'm getting my mind a little bit easy right here. So I'm gone
Mikey
already.
G,
I'm not coming to the
Mikey G,
doctor. I am not coming to the
I
doctor.
asked Dr. K a
Mikey
question and
G,
I'm lost.
Mikey G, Mikey G.
Yes, ma'am.
You and you're one of those patients. I'm telling you. Do you know that medicine is a historically patriarchal specialty?
No, I'm certain of it.
Do you know that medicine
I'm certain
is
of it.
historically patriarchal? So in your father's time, do you think there were female urologists?
No, I'm saying to you
Do you
that
think there was none? There was
they
probably
weren't.
one. There was no female urologist. So the person who would be seeing your dad as a urologist would have been a man. So now you would have had more female doctors over the past few years, or over the last 20, 30 years. You have a lot more female doctors.
But that's what I was
So
saying. There were female doctors when my dad was doing the thing.
yes, but then they might not have been the specialty that he wanted. So, I mean, if it's a general practitioner, yes, but as a urologist who will be probably specializing in male health, there might not have been. Unfortunately, coming back to 2024, there's a you have a plethora of female doctors,
Well, we are
so
grateful
you
now.
can.
Men
No,
are
no, I
grateful
don't
for
have
it.
a problem with you saying that, but I'm just saying, I've had patients come in and they get a male ultrasonographer to do say a prostate ultrasound, and they're upset, you
I am
know,
not. I
and the
don't
truth
know.
is that there might not have been a female, but if you needed a female, that you ask for a female.
Well,
Or for example, a woman who wants to get an ultrasound done, and or and it's a male. We try, I mean, in you try to accommodate. For example, if it's a case where it's a pelvic ultrasound, you try to get a woman. But sometimes it all depends on your facility. You may not have, I mean, you don't want to schedule a pelvic ultrasound with a male, but an abdominal ultrasound you might schedule with a male.
And that's not an excuse, Mikey G. The question is,
yes.
a young man would have been taken to the doctor by his mom all his life, and then now he has graduated university and he's gotten his job. He does not feel the need to visit a physician. Now he doesn't have to be taken. He can choose
Correct.
whatever, a beautiful female or a male or whichever doctor. So the
Mm.
question is, should you, as I know the women have routine medical examinations that we are required as, in life, and we do generally fulfill these requirements. But for the man, speaking about screening and health care, what would you recommend, Dr. K? Without the excuse that Mikey G gives, what would you recommend
Well, I would.
um, for
So
men?
a young 20-year-old gentleman who is just starting his career, just graduated from university, then he needs to go to the doctor because he needs to get his basic labs. So what you do is that he might not get a PSA or even his testosterone levels, because those are supposed to be high.
Mm-hmm.
But he's supposed to be talking, or PSA is supposed to be normal, his testosterone level is supposed to be okay. But he needs to get his basic labs done. Check his cholesterol, check his hemoglobin A1C, get his thyroid checked, just get his usual metabolic functions and his baseline for him. If he's having an issue, and he may not be having an issue, but you might have a baseline, talk to his doctor. The doctor might say to you, just to examine his male organs, just to make sure that they're fine. You know, some people may have an undescended testis, and they may have gone unnoticed for the entire time. So your doctor will check. Your doctor will also check your penis, because there's some men who will have problems with their entire penile structure. So sometimes sexual activity might be a problem for them based on the anatomy of their genitalia. So yes, your doctor will check on you to make sure. So it's just making sure that your basic function, even your sexual function, will be optimal. And you don't know, but your doctor will tell you, oh, this is happening. So you might not get a prostate examination at that time because it doesn't warrant, as I've said before, your prostate enlarges with age. A 20-year-old is not supposed to have, or 25 or 30-year-old is not supposed to have an enlarged prostate. So your prostate enlarges with age, but you're sensitized to the fact that you need to get these tests later on in life, and you have a discussion with your doctor. Later on, when you're older, they might want to do a PSA, probably when you're 30, 35. They might want to do a PSA on you as a baseline, but they might not do a rectal examination or even a prostate ultrasound at that time because it's not warranted at that age. Yes, sir.
If you're just joining us, you are here and you're at Wellness Wednesday, and we're asking Dr. K some medical questions. And listen, I had like 4 questions, and we are just on question 1. We'll
Have you
have to
got?
continue to part 2, but I am gonna say I have a question, but of course, Mikey
Number one
G had
question.
his hand up first.
Number one question is this one. Here's a question for Dr. K this morning. And of course, we're talking about prostate and men's health. And of course, here's the option number 2 that men always choose. We rather die. But here, no, I'm telling you, it's a choice. But here's the thing. I'm gonna ask.
And that's true. I've seen it. I've
It's a
seen
true
it in my
statement.
practice.
I rather die.
In
That's a
my
true
practice.
statement. So here's the question I want to ask, Doc. Not the rather die part, because of course, we are here for the long haul, right? How do men quickly identify that they're having a prostate issue, and to then visit their doctor if they're not prone to wanting to visit doctor? But this is an unusual activity that happens. How would you just an activity that would cause you to then get question in your mind that maybe there's something going on that I might need to check out? How would you?
Your
How would
stream,
you
your stream, your stream.
Not your
When your
internet stream, not how
not
fast you're
this one? How
streaming
fast my
or
your pee pee stream.
okay.
When you're peeing, your urination. I'm serious. A man who has a good prostate, he will be shooting over the fence. When a child is young and you see them pee, the pee shoot up into the ear and over the fence. A young man who pees, his pee shoots all the way to the neighbor's house. When they get older, their pee is not as strong. And it's a normal thing for it to be not as strong, but it still shoots out. Now, the moment you're dribbling and the pee is the stream is not as strong, it's time to go to your doctor to say, hey, you know, I usually pee and it's strong, but now it just a dribble out. It just dripping out. That's something is wrong. And don't wait until it dripping. Once you find out that the stream is a little slower, yes, have a conversation. Don't wait until it starts to drip like a pipe that you leave on, because that time it horse has gone through the gate, people. It's preventative, not treated, preventative. We don't want to be retroactive, we want to be proactive with
Proactive.
our health
And,
care.
and I have to ask this question. Now the questions are just coming. You mentioned undescended testes. And of course, women are taught frequently about breast self examination, knowing your body, and the same equates to men, right?
Correct.
Now you're
Correct.
supposed to have two testes, two
Two.
testicles, and
And one is a little lower than the other.
one is a little lower than the other.
you
And
mean you
it's,
mean that's men you're talking about?
Yes.
yes, and of
I find that
course,
a lot of our men don't really have any of those anymore. Sorry, you go ahead. With the question.
so as you mentioned, this is a condition in which, of course, the testes, one is not where it's supposed to be, right, Dr. K?
I think so. I think so.
Hmm.
I'm
Mikey
sorry.
G.
I'm sorry. I couldn't help it because I'm just thinking
We're going to put Maggie
the
G in the
testes,
naughty corner.
the testes
Can
for
we?
some of the guys are not in the place that it's supposed to be. And I'm thinking about that a while ago. I said,
And of
you know,
course,
We're going to
right,
put you
Lady
in the
Elise, that
naughty
question
corner.
is a very
Lady
valid
Elise,
question. Please, Dr. K, help us to answer it.
Lady Elise, we're putting Maggie G in the naughty corner this
Oh
morning.
boy.
so
Yeah.
of course, this is a medical condition which, of course, puts you at risk for other conditions later in life. And
Correct.
so it's important, men, I say that to
And,
say,
and it's not just in life because once the testes has not been descended, I mean, okay, so the testes anatomically is formed in the abdomen.
mm-hmm,
So when you're a baby, when you're being formed, your testis is formed in the abdomen, and as you get older, as the baby matures to be born, the testis moves down into the sac. So usually your doctor initially um once you are born, they should do a thorough examination. But remember, not everybody is born at home, you know,
exactly.
and not everybody goes and get the whole examination throughout their period of life. There are
No.
people who don't do that. Don't take their child to get their normal checkup and everything. They might go to the clinics and get vaccines,
And
but
that's
they
it.
don't go to the doctor to get their checkup. So you have to understand that not everybody gets the same care
Mm-hmm.
as a neonate infant child as everybody else. So that's something that you, as when you get that opportunity to get yourself checked out, you need to make use of that opportunity. So yes, you go to your doctor and you might not be examining yourself, or you, that's how your testis is always from your born. So
Yeah.
you don't think anything is wrong with it, but your doctor examine and feel one and don't feel the other, and will try to search all the way up and not feeling the other one. So your doctor will say, you know, I'm not seeing this testis, and the testis that is not descended is at risk for malignancy. So they have to search for it and send you for an ultrasound. And if they can find it, and depends on where it is, they can pull it back down and plant it down there. If they can't, they might have to remove it.
Doctor, you have answered a very valid question from this morning. Now I understand why some of our men are behaving the way they are. So one
Which
of
is,
their testes has not come down yet. I know that for a
mm-hmm.
fact. Well, Elise, but
Well, thank
there's
you
a
so much for adding that.
question in mind that
Dr. K and Mikey G, I don't know if the time would allow because, of course, we have touched on so many important aspects of healthcare. We're just touching the brim. And more questions, of course, are
here
springing from this question. Okay, Mikey G.
So
there's a question for sorry, Doc, you were saying.
I was saying we could have a part two next week because I'm thinking half of the questions have not been
Have not
answered.
been answered.
Half of the questions have not been answered.
Here is persons, and it's a question for many persons. We have heard about different defects in the blood and stuff like that. Sickle cell disease, for example. Do children, when one parent are, this is a question that is has bothered many persons, and of course, we got this one earlier. Um, Sickle cell disease, when a parent has it, does it transcend to the child when it is born?
Mm. Good
So sickle
question.
cell this yes, absolutely good question. Sickle cell disease is a genetic
Mm-hmm.
disorder.
Mm-hmm.
Yes.
Means that you cannot get it from blood transfusion, you can't get it from sexual activity, you can't get it from just associated with other people. Sickle cell disease is something that is genetic. As what sickle cell is, it's a mutation on position 6 of the hemoglobin chain, where there's substitution of valine for glutamine, which is two different proteins. So it's a genetic mutation. And this mutation historically came about in black people because of our the malaria,
Mm.
in order to fight malaria, because malaria is a blood-borne disease. the mosquito bite you, Plasmodium falciparum, and then it puts the bacteria in there, and you get malaria. So yes, so it's a mutation that has been passed down from generation to generation. So if one parent has the mutated gene, and the other, so you have two chromosomes, right? So you're passing down one. So if both parents have it, both parents pass one. It
Mm.
might be the bad one or the good one. So if you have only one, if you're carrying the one gene, you can pass the one gene or you can pass. So there's a 50% chance that you will pass the bad gene.
Wow.
But if you have the two gene, you don't have a good one. There's 100% chance that you're going to pass the bad one. And if the other person has sickle cell disease too, then there's 100%. So the child is definitely going to have the bad gene, both of them. But if one is normal and the other one is normal, then there's a 50% chance that the child will get the sickle cell disease. There's a 50% chance that you'll have a normal
Here,
child.
here,
If
here
both
is
people are carrying though,
here's another question. Sorry, you finish your point, Doc.
no, if both parents are carrying, then the chance increase. Yeah.
All
Eh,
right, I want to go to one. Sorry, Lady Liz, go ahead.
No, because as she touched on this question, then it says, is it possible for you to live all your life? Speaking about screening,
Mm.
what is the gap in the system that will allow me, who have the trait and never knew it until I got married to somebody now who has a trait, and then I have a child who has the full born? How is this happening in the 21st century, where we're talking about all this screening that we have been talking about, that I should know my numbers, I should know my blood group, I should know what my family history is, and then we find, and sickle cell is just one of the things that we can have traits.
Absolutely, absolutely, absolutely. But you know what happens, Lady Elise? Um, Unfortunately, especially in our black population,
Mm.
it's not always been screened, and um, I'm not sure if everybody, and it should be, you should have contact tracing where as long as you have the report that it's positive, then you have that. That's where the whole community health persons come in, or the department of health, where you contact trace the person.
Mm-hmm.
Means that you contact the person, find out the information and inform this person. But remember that if you have the trait, you may not have any symptoms. So because you're not symptomatic and you have nothing, and you're living your life normally, your hemoglobin may be a little lower than normal, but nobody's checking you for sickle cell disease, then you will go through the tracks. You have doctors who will just, and there's some people who just don't go to the doctor.
Mm-hmm.
But if you go to the doctor and your hemoglobin is a little low, they might send you for testing. I remember when I was young, I was young, and
Younger.
my yeah, younger. I mean, I tried to give blood when I was 17 years old. That was the first time I was trying to donate blood. And the blood bank wouldn't take my blood because they said I was anemic. And then when I went again to university and I tried to give blood again, they wouldn't take my blood. So I was sent off to get tested. My hemoglobin was a little low, so they sent me for sickle cell, for checking for over system parasites in my stool to see if I have worms, and check for all different things. Everything came back negative, and so they're like, "Why are you? So you need to go see your doctor because you need to go get checked up for everything because you're anemic." But the point is that if it wasn't a case where I was trying to give blood, I would even I'd go for many years knowing that my blood count is normal unless I go to the doctor. Because of course I'm a young girl. I'm not having any symptoms. I'm not weak. I'm not short of breath. I'm fine. I'm climbing Blue Mountain and going up there and I'm good. I have no problems. So that's what I'm saying. So you think you don't have a problem, it doesn't mean that there's no issue. And that is why a young man, even a young man who thinks he's fine, and he has no issue. You go to the doctor and they say, "Oh, your hemoglobin is 10. Why is it 10?" And they start searching, but you have compensated well all your life. You have no issues.
Here's a question, Doc, and as we step into I think the clock is on the wall, so it's time for us to leave. But here is something that I want to ask very quickly on a sickle cell disease issue. Is sickle cell a black person's disease in essence?
It tends to be a black person disease, but I mean, now that we're all mixed up, other people can say it's
Everybody's disease. So initially,
it's a predominantly
initially
black person
it's a black person disease.
Yeah,
Last question.
it is a predominantly black person
Last
disease.
question, Doc.
Yes, yes.
Last question. No, sorry, you're going to answer that.
No, that is it. No,
Last
I'm just
question.
confirming.
Men who have low testosterone levels,
Hmm.
is it prudent for them to get some form of testosterone application, something to increase testosterone levels in the body?
Yes, yes.
And if
Men
so,
who have
how?
There are many ways to get testosterone levels. Um, the common ways that we give them testosterone is giving them an IV application of testosterone.
But first, Doc, it is for the listeners' purpose.
Not IV, I mean intravenous, sorry, not IV. Could be an injection, testosterone levels. So the men they can use different things. They can use gels and creams, but and for absorption, but the main testosterone levels that we give when they're low is that we give them an injection that they probably get once a month, and then we keep checking their testosterone levels. But remember, you have the testosterone levels is important in a man.
Yes, that's what I was
And
going to get to, Doctor, for us to just tell us why testosterone is so important for man's health.
well, a man, the testosterone level is what makes you male. So your facial hairs, your voice, your sexual activity, your development of your sexual organs, it's your testosterone that gives you all of that. So what makes you male is your testosterone level, right? And you know that women who have a higher testosterone level tend to have more male features. They might have their voice, they might have facial hairs, they might have other things. And this is younger persons because as a woman gets older, her estrogen level wanes, and so she might have facial hairs based on the fact that her estrogen level wanes. So a woman, meaning that she has a high testosterone level doesn't make her not female, but her testosterone level may be a little bit higher. But a man who doesn't have who has decreased testosterone level, his whole functioning, so his muscle mass is going to decrease, his energy level is going to decrease, his sexual activity, his whole um, procreatory activity is going to be decreased because of
why
all
you
of
say
that.
it's so nice, procreatory?
Here's one for you. Here's one.
Procreatory.
Here's one for you, Doc.
I just coined that word. I don't know if there's a word with but it's procreation, so they must
This
be
is this is
procreating,
flashpoint.
right?
It's okay. It's flashpoint, right? Here is a transitional period where somebody. Is it possible that you could introduce through food? All right. So if estrogen, if testosterone
That
creates
was
the
your last question. You have to keep. You have to have this question next week, Mikey G, because it's.
all right. You know what I'm going to do? I'm going to leave the question until next week when we come back. Okay, this one is going to open up a can of worms. So leave that question right there for last. Of course, guys, it has been a minute, right? Doc, we want to thank you for
Oh
coming on.
man.
And it has been an exciting morning this morning. Questions that were asked and the answers that were given. I will say this right off the bat. The younger persons, and this is where the question was actually going, that they are saying, you know what, let me not say that anymore. But it was a good, I'm not going to say that because if I say it, I have to continue on the line. So I'm going to
So
leave it.
we'll talk about it next week.
We'll talk
Yes.
about it next because it is a question that needs to be answered, but needs a little longer time to answer it. Of course, if you join us next week, listeners, for at the same time next week on Wednesday for Wellness Wednesday, these questions and more will be answered. Of course, if you have your questions, please Be sure to post those questions, type those questions, or text them to the number 1345 321 6969 right here on Flashpoint. And of course, knock us up next week right here, Wellness Wednesday, in the morning time on the breakfast hour right here at Flashpoint.
All
Good
right,
evening.
and of course, we're going to get right into our news. Thank you so much, Dr. K. As usual, you have delivered a wealth of information. And of course, we'll work on that naughty corner discussion that we had
Well,
while we were.
as long as you don't
I
mention,
did not call any name.
as long as nobody mentioned doghouse anywhere around, then everything is fine. Naughty Corner is a good place. You know, I have grown up to
I
understand why.
I
What?
did.
No, as long as nobody mentioned the doghouse theory, you know, that doghouse thing that you hear, you know, because we know in Canada what happens in Canada is this: the family structure is like this. The female is first, the child is first, the female is second, the dog, then the man. Let's not use that concept on the breakfast hour and here. So, yeah, thank you very much.
All right, and now it's time for our news. Thank you so much, Dr. K.
Okay. Have a good. See you
Once
next week.
again, thank you very much for joining us this morning. It was a pleasure having you on this morning. And of course, hope to see you next week, same time, same place, right here at Flashpoint. Of course, remember www.flashpointmedia.ky. Listen to Flashpoint Radio all day and continue to enjoy. Of course, the rebroadcast of this program will come up this evening at 8:30 in the PM. All right? For those who miss it in the morning.
Okay.
Good morning. This is news headlines on Flashpoint Radio. I'm CoraleeKaren. Rescue plan sought for 7 Mile Beach. The Cayman Islands government is seeking expert technical assistance to restore the eroded southern end of 7 Mile Beach. A request for quotations has been issued for qualified consultants to help design a solution to replenish the sand which has been gradually lost over the years, exacerbated by recent storms. Current efforts focus on the southern section of the beach, with significant parts now submerged, threatening seawalls and buildings. $4.5 million contract for Central Scranton Park Development. McAlpine Limited has secured a $4.49 million contract to advance Phase 2 of the Central Scranton Park project. This phase includes a community center, a multi-sports court, bathroom facilities, and landscaping improvements. The project aims to enhance Georgetown's community spaces and improve quality of life for residents. CNCF charts a future of arts and heritage. The Cayman Islands National Cultural Foundation has unveiled a strategic redevelopment plan as it celebrates 40 years of fostering arts and culture. The plan emphasizes artistic expression, heritage preservation, and quality programming. CNCF gathered insights from over 100 stakeholders and the wider community to shape its vision for the future. HSM welcomes 10 students to internship program. The HSM group has onboarded 10 students as part of its legal internship program in partnership with CIFEC. The program, running until April 2025, provides hands-on experience in areas like immigration, corporate services, and marketing. The initiative reflects HSM's commitment to nurturing future professionals. In regional news, farmer grateful for road repairs. Dion Blake, a farmer from Cornwall Top, St. Elizabeth, has expressed gratitude for a newly paved farm road. Speaking at the opening of Phase 1 of the project, Blake shared her excitement about the ease and cleanliness the road now provides. The initiative, part of the National Farm Road Rehabilitation Program, continues with Phase 2 underway. MF&G recognized as top legal firm. Myers Fletcher and Gordon, MF&G, has retained its Tier 1 ranking in the IFLR 2024 rankings, highlighting excellence in financial and corporate law. Partners Peter Golson, Hilary Reed, Gina Phillips Black, and Simone Bow Jones were recognized for their expertise and client feedback. CTOC seeks public's help to locate person of interest. The Counterterrorism and Organized Crime Investigation Division is searching for 52-year-old Jason Kamiko in connection with an ongoing investigation. He is known to frequent West End Negril and Waterloo Avenue, St. Andrew. Anyone with information is urged to contact the Constabulary Financial Unit. Bahamas Police issue holiday road safety tips. The Royal Bahamas Police Force has released safety tips for the Christmas season, urging citizens to prevent impaired driving and ensure pedestrian safety. Recommendations include arranging sober transportation and reporting drunk drivers. Gas cylinder fire in Guyana clarified. Massa Gas Products Guyana Limited has confirmed that a fire at a home in Better Hope Village was not an explosion. The fire, caused by a new gas cylinder, was quickly extinguished with no injuries or property damage reported. TCI police investigate violent crime spree. The Turks and Caicos Islands police are investigating 3 armed robberies, including an assault at a service station, a robbery at a restaurant, and an attack involving a cinder block. Authorities urge vigilance and public assistance in identifying the suspects. Caribbean women honored in BBC's 100 Women list. 2 Caribbean women, Adenio Del Rio of Cuba and Gerline M. Joseph of Haiti, have been named among BBC's 100 Women for 2024. Del Rio has revolutionized Cuban fashion with her sustainable brand Clandestino, while Joseph advocates for immigrant rights, reflecting the region's vibrant female leadership. Those were your news headlines on Flashpoint Radio. Stay tuned for more updates and analysis throughout the day.
When you need ultrasound that's safe and effective, you must visit Asai Ultrasound Imaging. They're conveniently located at number 4 Chestnut Center, Smith Road, Georgetown, Cayman Islands. With experienced technologists with over 20 years experience, their friendly staff will make you comfortable while you get your procedure done. Asai Ultrasound Imaging is open Mondays to Fridays, 9 a.m. to 5 p.m. and 9 a.m. to 1 p.m. on Saturdays. Call Asai Ultrasound Imaging 345-949-2454 or 345-938-3426. That's 345-949-2454 or 345-938-3426.
Of course, aside ultrasound for all your ultrasound needs right here in the Grand Cayman Islands. And of course, this morning we want to say good morning if you're just joining us. of course, we had what an exciting piece of information that we shared earlier on. Of course, Dr. K was on. Of course, our Wellness Wednesday is here. Of course, join us next week, same time, same place for the Wellness Wednesday, guys. Of course, news, Lady Elise. I don't know what's going on in the news for you this morning.
A lot happening in the news, but we have to quickly,
Hustle.
we have to mention, of course, our community notice board. We have to say special good morning to Miss Lucy
Yes,
over
yes.
there in
Lu-
St. Lucia. Yes,
Saint Lucia, the
good
Saint
morning.
Lucian. And so I want to say a big up and a big shout out to all Saint Lucian in the Cayman Islands and of course in Saint Lucia. Of course, she's asking us to send a special belated birthday greeting out to a good friend of hers this morning, Lady Elise. And of course, let us do that now.
Oh yes, I need to find that greeting. I need to find that one. And then share it.
Well,
Actually,
I had the greeting yesterday, of course.
yeah. So where is it now?
I have it.
Could you send it to me, please? Or
All right. So what I'll do then, I'll send it. I'll send it to you, and of course, let me send it over to your phone so you can have it. And of course, so we can actually share it this morning on Flashpoint. Of course, the exact greeting as it would be rawly done, right? You want to do it like how she said it. No editing. I could play it, I could, but I
all
guess
right.
you do.
Let,
You
let
better.
me let me go ahead and share it.
All right, let's share this one. Of course, we want to say shout out to all those who are celebrating special days, special anniversaries, and of course, if you're doing your what you call your 25 years of marriage and all these things, yeah, man, 10 years marriage, these markers that people keep marking up. And of course, if you're celebrating a 50th birthday, and of course, saying, yeah, man, strong and age is just a number, tell yourself that lie one more day. That's okay.
Let's hear the greeting.
All right.
Good morning, Sister Elsa and Brother Michael and Flashpoint members and groups and media associates. I would like to send out belated birthday greetings to my dearest friend who said I am her adopted mother. She's Juliet Barnett in the Cayman Islands. She celebrated her birthday on she celebrated her birthday on Saturday. She celebrated her birthday on the 40th. She celebrated her birthday. So special birthday greetings going out to her, wishing her God's richest continued blessings, and may she continue to be and remain the sweetest and loving person that she is. Greetings coming all the way from sweet, sweet St. Lucia, from Sister Lucy. And blessings to you all and the team. Have a blessed and wonderful day. Thank you. Bye bye.
Ah, yes, yes, yes.
Thanks to Miss Lucy this morning from St. Lucia. So, all Lucians, my friend, I want to say big up, we have a Lucian bridge in Cayman, of course, at the Emily. I want to big up the side this morning. I want to big up the side this morning, my Lucian brethren. Of course, I think he has a St. Lucian wife as well. It's true, right? I want to big up
Yeah,
the
so
side.
happy birthday, dear, from
His side children. I think he's out now with two. He's gotten two now. He's moving along.
yes, he's out with two.
And I'm on Ebenezer this morning. I want to say, remember, guys, head on out to the Ebenezer SDA, of course, the King's Church this evening, of course, for that convention that's going on at the King's location. Keeping
And before you go to Dr. McDonald the first, um, I believe its birthday is today. I've seen it on social media. I've seen birthday greetings coming out, and of course, we want to add our quota of birthday wishes
Well,
and
you mean
greetings.
you mean Dr. Wilton McDonough?
Dr. Wilton McDonald.
Pastor at the Borden Town Church when I just got to the Cayman Islands.
Yes, yes,
That's
yes.
the
That's
one.
the one. Today is his birthday,
Lord,
so wanna just
I
wish him a happy birthday from the Flashpoint,
tell you
from the
something. Let me
Flashpoint
tell you something.
team.
I have great respect for this gentleman. And I don't know, man. It is impossible. I know the time is going. I know, Lady Elise. But let me tell you something. I have to at least say, Doctor McDonald, I want to say to you, Pastor McDonald, thank you, thank you, thank you. Because when I got to the Cayman Islands, I was just kind of tweaking around with my Christianity. I wasn't even too sure how this thing going to work out because I just started going through this. What do you call it? Puberty, my puberty of Christianity. You know,
Yo,
uh,
who?
puberty of Christianity. Yeah, that's what I was going through. And of course, I was not going to be taking any puberty blockers. You know, Pastor McDonald would have met me on the journey and would have given me the opportunity to do some great things. So I want to say thanks, Pastor. And of course, whatever I am aspired to do, I would say because of your mentorship of the early stages. Primary education is the most valuable and the key to our success as we go forward. Thank you very much. Of course, remember, as we go and traverse our busy highways, stop by the Ebenezer SDA Church, of course, by the King's SDA Church, where the Ebenezer is going to be worshiping this evening. Have a great campaign going on. Go and check it out this evening at the King's location on Walker's Road. Never forget, of course, stop by Flashpoint and, of course, get a little bit of that also at 7:30 in the PM this evening.
Right,
It is
and of course, we're not getting out of here without our community notice board, Mikey G. So I'm gonna just going quickly through the things that we do have on notice board, and of course, the King's Music Day is one of such
I
events.
have a favorite song. Do you have a favorite song?
If you do, then join us on December 7th at the King's Seventh day Adventist Church for our Music Day. The theme, This Is My Song. And trust us, it's going to be an unforgettable experience.
Music has always been such a powerful force, connecting us to God and each other. It lifts our spirits, inspires our faith, and fills us with joy. And on this special day, we'll be celebrating songs that have moved generations of Christians.
Kicking off the Sabbath school at 9 a.m., we'll dive into music that speaks to our hearts and souls. And guess what? Our divine service starts at 10:30 a.m., featuring none other than evangelist Omar Walters as our dynamic guest speaker.
Plus, get ready for performances from our church sanctuary choir, our children's choir, and amazing solo singers who will bring the house down. You do not want to miss this.
Whether you're a lover of hymns, gospel, or just want to be surrounded by the power of song, December 7th is your day. So bring your family, bring your friends, and come experience the music that brings us all together.
That's right, folks. It's going to be a day of worship, inspiration, and of course, great music.
So mark your calendars, spread the word, and join us at the King's Seventh day Adventist Church on December 7th for Music Day.
See you there.
all right. King Seventh Day Adventist Church, of course, graduating, is past is Omar Waters has now become an evangelist. And I'm telling you, I'm up for that one. Long time coming, Lady Elise. Coming.
Yes, and up at this on the screen now, of course, is the Quartet Fest. Of course, also this Saturday, December 7th at 3:30 p.m. at the King's Seventh Day Adventist Church. Of course, they'll have SDA churches from across the Cayman Islands, men's quartets, ladies quartets, and a mixed quartets. Always a privilege and a pleasure to watch that one. And of course, we are so happy, and I also want to just get our viewers in the frame of mind. We are coming up with our hike. Our Blue Mountain hiking adventure comes up. Yes, in 2025.
Yeah.
And listen, if it's on your
2025 Blue Mountain hike, yes.
yes,
I've never been to Blue Mountain, so I must tell somebody that because I've never been to Blue Mountain, Michael G is going to be definitely wanting. This one is something that we have actually been looking forward to for at least since the beginning of this year. We
yes,
started the idea that we wanted to do this one from the beginning of this year, 2024, and of course in 2025 we are actually going to be realizing this one. Of course, coming up in what, February? We're having
yes,
that one.
yes, yes. So mark your calendars. We're going to be sharing more information about that adventure flashpoint in association with Take a Hike. Of course, we'll be putting on this hiking adventure. You must be a part of this one. And also coming up in 2025, of course, we will have our karaoke. Yes, we will have our karaoke as usual. And so we'll be sharing this every morning. We will be having you all geared up so that when we drop the date, you're
We're
just
ready.
you're
Of
ready.
course,
You're ready for that
so many
one.
things and more coming up later on Flashpoint. I want to thank you, Lady Elise, for this morning's experience, and of course for the viewers and listeners who joined us this morning. Of course, I want to thank Dr. K also for coming on, and of course for CoraleeKaren for the newscast, as always ably done each morning. Of course, to bring you that satisfying pleasure and of course the listenership to the Flashpoint Media platform. Of course, each member, each person who is a part of this, the VIPs members, I want to say a big shout out to our VIPs, guys. Stay locked, stay tuned, and of course, there are great things coming up. For those who did not get a chance to join us at our last event, that was VIP and our members and staff, for our staff, what you call it, get together. Next time, guys, we're having another one coming up. So keep safe. Have yourself a beautiful one.
Have yourself a beautiful one. I must acknowledge, of course, the fact that Hazel DG shared a riddle this morning. What is the hardest key to
I saw the
turn?
riddle. I saw the riddle. I
And
want to
so
say good morning to Hazel.
she needs to also supply the answer. I see two answers, one keystone and another donkey. And of course, we will share who the winner is as soon as we'll share that information in the VIP chat. A special good morning to Grace over there in Jamaica. She said in the chat, God didn't promise days without pain, laughter without sorrow, nor sun or without rain, but he promised strength for the day, comfort, the tears, and a light for the way. Of course, we want to thank VIP Grace for sharing that lovely thought with us, and of course, good, good.
I want to say then to add my bit. Of course, I want to say good morning to Elvira, all the way in Nicaragua this morning. Of course, strong VIP member. Of course, bringing and burning the torch across the Nicaragua landscape for and with Flashpoint. And of course, we of course must at some point go to Nicaragua, and of course,
Of course,
we
yes.
must. So I want to say a big shout out across the airwaves, across the seas and land to Nicaragua, of course, Elvira, who continues to burn the flame for Flashpoint in that neck of the wood.
Yes, I want to thank you all for joining us again. And, if you look on your screen now, you would see the highlights of this weekend's appreciation. And we will still want to say we thank all the viewers, all the listeners, those who have joined us on YouTube, Facebook, Instagram, those who have always been there sharing our thoughts, sharing the link. We want to encourage you to remain connected to us. If you haven't subscribed, please go ahead and subscribe to our YouTube channel. You can also shoot us an email at info@flashpointmedia.ky. We have very rich programs throughout the day on our radio, www.flashpointmedia.ky. And if you need to give us a call, of course, the number is 345-321-6969. That number available on WhatsApp. I want to just leave with you our optimist thought for today. Of course, we have taken the optimist creed, and we have made it our own. And we have said, promise yourself to be strong, that no one can disturb your peace of mind. Have yourself a very well Wednesday. Mikey?
Well, I was just going to say, when all of that was said and done, Lady Elise, I was saying, listen, I am done. I guess everything that was that you have said, it would be just a repeat that I would have to repeat all of those things. So I would have refrained from even uttering a word. But what I would say next is this: that we thank our listeners each morning, each day. For those who have supported us, for those who have liked and shared the videos, and of course, our information across the world, across the globe, we want to thank you very much for doing so. For those who have participated in financial support, we want to say thank you very much for your financial support. And of course, remember, advertise with us, keep advertising with Flashpoint, and of course, get your message out there to somebody who needs to know. All right? Have yourself a beautiful one, guys. Have yourself a beautiful day. Continue to listen to Flashpoint Radio, www.flashpointmedia.ky. Great stuff coming up next. You will hear so much more. Of course, catch me later on, 2 to 6, the Super Mix right here on Flashpoint. I bet you didn't know today's Wednesday Wellness. And of course, have yourself a God.
Getting stuck in the hurdles of yesterday. Don't you wanna go further away from the fray? Let's not get stuck in our worries. We'll make our own way. Won't you come outside where the sunflowers bloom? Breathe in the air. Look up to the moon. I'll meet you outside, away from the crowd. Just you and me together, it will all seem better outside. Just us in the sky. I will go wherever, I'll be yours forever.